Hello guys, welcome to our Sureshot series. Today we are going to discuss about the ENT topic of what are the types of the hearing loss and what are the tests that we can do, like Weber's test and the Rinne's test. This is also one of the most important topic for your Neetpg and FMGE examination. So before we dive into the topic, I want you guys to subscribe and share with your friends. So let's start our today's video, hearing loss. So when I say hearing loss is subdivided into the four types. So the mild hearing loss, which will be 26 to 40 decibels, and the moderate hearing loss 41 to 55 decibels, and the severe hearing loss, it is around 71 to 90 decibels. Even though if it is more than 90 decibels, then we have to call this as a profound hearing loss, that will be around more than 90 decibels. So when I say hearing loss is subdivided into the two types. One is your conductive hearing loss and another one is your sensory neural hearing loss. So conductive hearing loss, the mostly this will be involving your external ear and also the middle ear. So what are the pathologies that we easily encounter in this conductive hearing loss? Congenital defects in the patients. The patients, those who are suffering from the external ear defects like anosmia, atresia, that kind of. And also like otosclerosis. These are commonly seen with the ossicles dysfunction and the effusion. Infections like otitis media and otitis externa. So these are the commonly seen in the conductive hearing loss. Next, coming to the sensory neural hearing loss, this is usually due to the cochlear pathology or the vestibulocochlear nerve, and even those who are suffering from the congenital defects due to torch infection and trauma cases. So these are the commonly found in the conductive hearing loss and the sensory neural hearing loss. Here you can see these two, which will be considered as a conductive hearing loss, and this alone thing, which will be going to consider as a sensory neural hearing loss. So let's see how to interpret using the Rinne's test and the Weber's test in the OPD purposes. So always you have to use the 512 Hz tuning fork for the diagnosing the Rinne's and the Weber's test. So by the picture, even if it is given the image based question also, this is your Weber's test and these both are your Rinne's test. So first let's start to interpret the Rinne's test. In the Rinne's test, we are always going to compare the bone conduction to the air conduction, and always what we are checking in the Rinne's test, usually your external ear and the middle ear only. So in the external ear, the air conduction is always better than the bone conduction. So whenever you vibrate the tuning fork and place it beside the ear, so the air conduction is well appreciated by the patient than the bone conduction which is placed on the mastoid bone. So this is what the air conduction is better than the bone conduction in the Rinne's test. So Rinne's positive is air conduction is better than the bone conduction in all the individuals of the normal patients. But in case if the patient is not appreciating the air conduction, that means his bone conduction is better but air conduction is poor. So this is Rinne's negative, commonly seen in the conductive hearing loss. But we will be getting the question, what about the sensory neural hearing loss? How can we interpret these patients? So usually sensory neural hearing loss, what we discuss, sensory neural hearing loss is in the inner ear, right? Inner ear is always better for the bone conduction. Okay, it will be bone conduction only. If the bone conduction is the problem in the inner ear, so the patient cannot appreciate the bone conduction. He will be appreciating the air conduction only. So in the sensory neural hearing loss patients also, the Rinne's test is positive. So air conduction will be appreciated, but bone conduction is poorly appreciated by the patient. So this is your Rinne's test interpretation. Next, moving on to the Weber's test. In the Weber's test, we are always going to check the way whether the patient is able to localize or the differentiate between his vibration to the better ear or the defected ear. So how we are going to start the patient examination? Vibrate the tuning fork and place on the forehead of the patient. If he able to appreciate the vibration to the both sides localization, so that means that the patient is having the normal hearing sensation. But in some patients, those who are suffering from the sensory neural hearing loss, let's say the patient is having the right side of the sensory neural hearing loss due to cochlear dysfunction. When we vibrate the tuning fork, when we place on the forehead, the patient is going to appreciate the vibration on the bed area. That means on the left side. So the patient better ear will be lateralization or the localization of the vibration will be heard on the left side due to dysfunction of the right side of the ear. So this is the positive sign of the Weber's test in the. So when the patient is having the defect on the right side of the ear due to otosclerosis or the effusion of the otitis media, how the patient is going to appreciate or the localize this vibration, he will be appreciating on the right side itself here only. So this is positive Weber test in the conductive hearing loss. So this is how we have to interpret between the Rinne's test and the Weber's test. So let's summarize the both Rinne's test and the Weber's test. When I say hearing loss patients, when we are checking the Rinne's test, what we are going to check the conduction, guys? Usually the air conduction should be better than the bone conduction in all the normal patient. But in the sensory neural hearing loss, the bone conduction will be poorly appreciated, but the air conduction is better. So this is what the positive Rinne's test. In the conductive hearing loss, it's always bone conduction is well appreciated by the patient than the air conduction, because he will be having the middle ear or the external ear pathologies. Next, moving on to the Weber's test. Weber test is always lateralization or the localization of the vibration. So in the normal ear, when it is heard, that means that the patient is suffering from the sensory neural hearing loss. In the conductive hearing loss, it will be affected in the middle. In the conductive hearing loss, it will be affected on the same side of the ear. So this is how to interpret the Rinne's test and the Weber's test. So please focus on these kind of high-yield topics in the previous year exam topic. Whenever you are reading, you have to remember the revision is must for the next time reading. So always remember, read, revise and review your own performance. You always have to understand the concepts behind the every topic so that you can easily answer in the examination. So those who haven't subscribed yet, please do subscribe to this YouTube channel. And for more updates in the MCQs and the notes, please join the Telegram and WhatsApp group. Thank you.